Thank you so much. So we're going to start by just, first doing introduction. So today webinar is about the role of tech and analytics in healthcare. And so we have wonderful people, Mark, Naomi, and Gladwell. They're going to, discuss with us how tech and analytics support healthcare. Today we understand the age of AI and machine learning. A lot of tech is being applied in healthcare, and that changes how we do things, how we live, and even how we're going to move from where we are today to the next coming generations. So they're going to support in doing that, helping us, and of course, giving us more details. Our moderators today will be Grace and Tony, and then QA will be led by Harriet. I'm not sure whether she joined already, but she will be taking us through that session of Q&A. So it will be a very simple thing. First, just like what we're doing, introduction, and then Grace will going to introduce the panel, and then she will take over as with Tony to take that moderation time, and then QA, and then final remarks. I think that will be it. So we expect to be out of this meeting in the next 57 minutes. Okay. So welcome everyone, and I want to appreciate your presence this afternoon. Keep on sharing this information. It's very important. So I need you to understand this is a webinar organized by KUSAT. KUSAT is Kenya US Tech Forum, sponsored by 7-8. 7-8 is data analytics, a tech company that does training in analytics and of course coding for kids. So it's a combination of both 7-8 and KUSAT that managed to bring us this webinar. Welcome everyone. Grace, to you.
Good morning, everyone. Good night, everyone. Good evening, good afternoon, depending on where you're joining us from. Thank you for joining us. Today we have 3 guests. We have Naomi, Gladwell, and Mark, and we'll be talking about the role of tech in analytics, tech and analytics in the healthcare system. And I think I'll just get straight into it. So karibuni sana our panelists. So what I'll do, I'll ask questions across the board for all the panelists at the same time. So let me start with Naomi. I'll start by asking, how can advancements in technology, just a minute. How can advancements in technology such as AI and machine learning improve patient care and outcomes in healthcare settings? Karibu sana, Naomi.
Hi, good morning, afternoon, evening, everybody. My name is Naomi, as you've been told, and I am in healthcare. So how can we use AI, artificial intelligence how can we use it to advance healthcare? Currently, I'm really immersed in healthcare and technology, and believe it or not, we have some segments of AI that have already infiltrated in healthcare, but at a very subtle level. Things like, for example, things like chemotherapy treatments, radiation treatments, and things like provider interpretation of dictation. So that has already been implemented. Now, how can we utilize AI as a general, improving generally improving patient care? We are still in the phase of trial and error in artificial intelligence coming face front for the patient, but in the background where we're doing data analysis, we're using AI to help us interpret and geographical areas of based on population diseases. So it's already there. It's just expanding it so that it can now be actually patient facing. Thank you.
Thank you for that, Naomi. You've mentioned something very interesting about data analytics. I think I'll throw this question to Mark. Mark, what are some of the key roles and responsibilities of analytics analytics professionals in healthcare? And how do these roles contribute, say, to patient care, operational efficiency, and also in decision making?
Well, thanks, Naomi, for having me, and Sevenet and Kusat. So it's interesting. So I think analytics professionals have different roles generally. But in my opinion, I think the key main roles and responsibilities of these professionals in healthcare are three. Number one, analytics professionals are quite essential in doing patient data analysis, where they're able to dissect huge amounts of patient data, and then they're able to derive meanings out of them. Some of this data would include things like medical records, test results. It might also be treatment histories. So they're able to basically apply statistical methods and machine learning algorithms just to help them identify those patterns and crucial trends to help understand patient populations. The other thing that I think they play a key role in is in operation optimization. So analytics professionals help in streamlining operational processes generally by, for example, analyzing patient flow data, and then they're able to identify certain loopholes that might exist in emergency departments or even in outpatient clinics, for example. And with such kind of information, then administrators are able to allocate resources efficiently just to ensure that they reduce waiting times. And finally, I also think analytics professionals are important in strategic decision support, because most of the insights they're able to derive from data can be used by executives in allocating resources, for example, in those healthcare facilities. Yeah, so just like I said, there are different roles that analytics professionals can play, but those three ones are the key important ones. Thank you.
Thank you, Mark, for that. I'll move on to Gladwell. Maybe you can tell us how technology has transformed the traditional healthcare models, especially in delivery, and what are the most, in your opinion, notable advancements that have positively impacted the way patient care is carried out?
Thank you very much for that question. I'm happy to be here. I just wanted to weigh in that technology has really advanced healthcare in numerous ways. In our traditional way of operating, we would take information and use the same kind of data sets to use our equipment and use our learning in very simple ways, meaning that it was repetitive. There was not much learning or addition. We would rely on research, which, as you know, sometimes takes a while for research to approve new knowledge to implement and add to healthcare. But what tech has done now with the data and machine learning, which is the processing of this data and then taking it a level higher to AI, where we're talking about having AI inform healthcare, we have now become learning organizations. We have become learning professionals from tech. And so it has allowed us now to evolve healthcare with best practice. And it has also allowed us to improve our services, better patient satisfaction, more efficiency, better safety. So these are the things that tech has allowed us to do. And it's an ongoing process.
Thank you for that, Gladwell. And I'd like to ask Naomi, kindly explain to us what is telemedicine, and virtual care, and how is that helping bridge the gap, say, in remote or underserved areas, and how patients and health providers are using this to bridge the gap?
Thank you, Grace, for the question. Interesting enough, this was my one of my masters. It was one of my didactic capstone projects, and telemedicine and virtual medicine has grown so rapidly, and COVID was a very good steer to that, because it just increased the rate of growth for telemedicine and virtual medicine went from like 10% to like maybe 200% during COVID. And COVID was a big factor in telemedicine. And what it has done tremendously, it has helped bridge the gap between patients getting access to providers and the providers being readily available on their smartphones. So, for example, in my organization, what do we do? One of the tasks that's added onto the home health department is to make sure that when they get to the patients' homes, they're supporting them and making sure that they're understanding the technology of just being able to add the app for their provider, how they can save the provider as their favorites on their app, and how they can just send a quick message to the providers without even having to go to the doctors. So telemedicine is huge. It's helping actually bridge the gap for one of the really, really underserved population, which is mental health. It's really helping because the patient does not have to be stigmatized by going to an emergency room to say that I am having depression. So it has really, really taken a really good, upward curve even to the areas that, patients don't feel like they actually need to go and wait for a very long time in the emergency room. All right, thank you.
Thank you for that, Naomi. Very interesting. Mark, you've talked about data analytics professionals, but we'd like to know more about the skill sets and educational backgrounds that are desired for such a person who wants to get into healthcare and still use tech.
Well, so yeah, that's a good question. I think I'll speak from a point of analytics professional myself. I think the two main skill sets that are desirable for this industry, first of all, would be the technical proficiency. As you know, analytics is all about using technical tools like Python, R language, SQL. These are just programming languages for those of you who might not have interacted with them. So number one, you need technical proficiency in at least one of these languages to help you come up with modeling techniques that will be able to synthesize data for healthcare. The other item that you also need is something I call domain knowledge for the healthcare industry. You need to have a solid understanding of the healthcare systems. And this would include, for those of you who are in healthcare, I'm not. I think this would include things like clinical workflows, understanding regulatory requirements in healthcare. By extension, you might also want to have a bit of understanding in medical terminologies so that it's easier for you to synthesize and contextualize some of the healthcare data that you get in order to derive meaningful insights out of them. In terms of educational background, I would say you need either degrees or just certifications in healthcare informatics. You might also have qualifications in data science, either degree or just certification. And And like in myself, I have a master's in business analytics. So that would also be an educational background that would prepare you for this industry. Yeah.
Okay. Guys, remember you can send in your questions to our panelists on the chat below. Then they'll be able to answer your questions after this session. I'll move on to Gladwell. I know Naomi has already talked about machine learning, AI, and how it can be used in the context of healthcare. But I wanted to know more about how can you improve patient outcomes while ensuring their safety and privacy while using AI and machine learning.
Thank you so much. Okay, yes, now Naomi gave really good examples. What I would add to that is we need to have our patients become more engaged in their care. And how IT is able to help with that is with the numerous apps that are out there. There are all kinds of apps. For example, I'll give you an example called MyChat. That's just one of the applications for healthcare. It's a way that a patient is able to essentially have their electronic health record on their phone. So with that, they're able to access their information, they're able to share their information, they're able to communicate with their doctors. They're able to even monitor their own healthcare as far as blood pressure and sugar and things like that. They're able to communicate and let their doctor know what they think would be best for themselves. They can communicate the outcomes of their treatment. And they're also able to engage treatment, like Naomi mentioned, virtual telemedicine and having sessions online. Safety is enhanced because of the protection of their information. There's very high privacy laws that come into play in the coding of these apps. And also the fact that best practice is being used. I mean, AI is taking huge data sets from so many different areas, not only locally, but internationally. And it's coming up with information that is useful to the patient and the healthcare providers so that they are able to come up with what is best for that particular patient. So there are fewer mistakes, there are better treatment plans, there are better measures that are communicated with the patient in terms of crisis and things like that. So it's such a broad and fast-growing field. This whole thing of AI, of clinical informatics, like Mark has mentioned, it's just so quickly growing. It's hard to put it in a few words, but those are some of my thoughts.
Thank you for that, Gladwell. It's interesting to see how tech and healthcare marry into each other so seamlessly. It's almost like they're made for each other. And it's getting the insights from all three of you is very interesting. I want to hand over to my co-host, Tony. I can see he's in the call. Tony, you can take over now.
Thank you, Grace. Just fixing one or two things and then I can come in, just proceed with the next one and then I'll pick up from there. Thank you very much.
Okay, sure. I'll move on to Naomi. There's the electronic health records that have become increasingly prevalent in healthcare systems. How can these systems be optimized to improve efficiency, reduce administrative burden, and enhance healthcare? Especially since I've heard Mark talking about data analytics need to understand databases and stuff like that.
Thank you again, Grace. I think if you're going to talk about EHR, right? I can only highlight, but this is a topic we can talk for days. EHR has actually made remember, I started practicing when we were doing paper. We did not have electronic medical records. So I've been in it to a point where I have seen the difference, and I've worked in organizations that still struggle to implement the EHR, the fast growing and the advancements and the updates. And an organization that just keeps up with technology. So what I can say there's a huge difference with how care is now provided, right? Because long time ago, if you're talking to a provider over the phone and it's a paper-based chart, you had to read everything for the doctor. Now the doctor just wakes up, if you're calling them, and they just open the chart from their phone and they can actually look at the patient's records and results and give you the next steps forward. What has that done? It has decreased errors significantly. It has improved patient outcomes significantly, because when we didn't have electronic medical records, providers had hesitance, thinking that maybe you're not relaying the accurate, lab results and things like that, or like maybe they thought that you're not reading accurately what you're actually looking at the paper chart, right? But having the electronic medical records, it has improved really and helped to reduce medical errors. It has improved efficiency because we don't have to sit on the phone for 30 minutes trying to have a clear conversation. You can just page the doctor and they log into the records and they look at the results and be like, okay, they decide on what needs to be done, and they put in the orders right there and then. So it has decreased errors significantly. That's one of the biggest benefits. The other benefits of the electronic medical records, it's just the availability. They're available anywhere. The provider can just be anywhere and still continue being consulting and just being able to give advice to the providers. And it's administratively, it's cut back on a lot of paper waste, which we are saving on trees, which is a good thing. We don't have to keep track of a lot of papers because everything now is just scanned and it's stored electronically. And the other benefit is multiple people are able to look at the same record at the same time, versus when it was still on paper, everybody had to wait. Like, okay, the doctor is looking at the chart, and then the case manager will have to wait, and the case manager has the chart. The nurse has to wait. Oh, okay, now therapy has the chart. So the electronic version of it, anybody can continue documenting, anybody can continue reviewing the chart. So that has helped tremendously. Yeah, so that's what I say. This is a topic that we can talk forever because it's helping even just the data part. It's helping collect a lot of data that maybe we undermined areas or specific diseases that were just, we couldn't get the information at a very rapid pace. But now with the electronic medical records, we can narrow down and say, okay, this particular segment, we're having a lot of, can we see whether other hospitals are having the same diagnosis coming in, or what is it that's happening in this area? So even it has helped with data analysis and population analysis to see whether some areas are affected with more diseases. So I think I can keep going for EHR. It has helped, but it has made a huge difference. When we look at it from the front end users, could we use more efficiency? Probably, yeah, we could. We could still enhance how it's working right now, especially for the front line providers. We could still tweak it a little bit more, so it's a little bit more intuitive based on what's going on with a particular patient, and more prompting versus a lot of because they feel right now it's still, I would say it's still still in the early stages of growing to make it a little bit more intuitive. But that's all I can say for now, because I can talk forever about EHR because that's like my specialty.
I like your energy around this topic. And I like that you're pointing out that it's the early stages, meaning there's still so many opportunities in improving the system. And
Correct.
that means there are many other opportunities for tech students to actually innovate and work in that space. Over to you, Mark. Talking about opportunities in this space based on what Naomi has said. What would you say are the career paths that are available for healthcare analytics, and how do these roles vary in scope and focus?
Well, listening to Naomi talk about electronic health records actually brings me to the role of informatics professionals in the healthcare industry. So informatics specialists, for example, are the ones that are in charge of optimizing the EHR that you've heard Naomi talk about. So they're able to ensure that that is essentially put together and optimized in order to handle data correctly. That is informatics specialists. We have data analysts. You might have heard of them, definitely. They play a very significant role in the modern world of tech. So what they do in a healthcare setting is they're able to prepare dashboards to generally come up with visualizations about healthcare data currently. They use the current data to come up with those kind of visualizations that will be able to inform decision-making by professionals. We, in addition to data analysts, and I think these two are usually confused for those of you who are considering to get into this profession of analytics. There is data scientists, and then there is data analysts. Those two are usually confused. So a data scientist, a data analyst, for example, like I mentioned, they simply use the current data to come up with dashboards and visualizations that then would be used for decision-making. They're able to derive insights. But a data scientist goes further to develop scientific models by using historical data, yeah? So they would do things like natural language processing, which is, you realize there are these chat boxes for different organizations nowadays. So when you have an inquiry, you simply chat and then you feel like someone is responding to you. In the current world, you don't even chat with a human. All that is robotic. So that is what we are referring to as natural language processing, where the computer or technology is able to understand human language and come up with very quick responses to that human language in a manner that does not really deviate that much from what a human being would do. So just to answer your question, I think there are a variety of career paths that you could follow. Personally, I'm in business analytics, which I think, looking at what I've done, it's a mix of both what a data scientist does and what a data analyst does, because I do a combination of those two. Yeah, thank you.
Thank you for that, Mark. I've noticed that you've mentioned a lot of things that deal with the patient engagement with the system and the healthcare providers. And you've talked about chatbots, you've talked about the user interface. So I have a question for Gladwell. How can patient engagement and empowerment, how are patient engagement and empowerment crucial for improving health outcomes? And how can technology help to foster this and give patients a better experience in understanding more about their health?
Thank you for that. Yes, patient engagement is actually very important. The use of technology comes in with a lot of the applications that are out there. Some of these applications are not just out in the market, some of them come through the health systems. So for example, like, let's say we're talking about one of our local health systems here in Kenya. Let's say we're talking about Aga Khan. For example, Aga Khan might say that they're going to develop an app and they're going to create a portal for all the patients to be able to log in and to look at all their blood work, all their test results, any communications from their doctors. The patient can go ahead and schedule appointments without having to call either the nurse or the secretary. Some of the visits can be done virtually. You can see how this can be a very powerful tool. Things like billing can be done virtually, as things like discharges can be done virtually or through these applications, so that it cuts back on a lot of time, a lot of wastage. The patient is able to keep track of what medications are being used, how much is being spent. The patient is able to communicate with the doctor and come up with treatment plans that work for them. For the organization itself, you can imagine that the health system is now actually talking to all its patients at the same time. It cuts on a lot of the staff needs, no real needs to line up traditionally like we used to. You can imagine that if everybody's able to go onto their phone and use their portal to answer a lot of the questions or address a lot of the issues that they may have, then we are cutting back on the need for staff, and we are now able to concentrate more on treatment and care. We're also cutting back on costs and wastage. There is efficiency because the data that's being collected from the patient directly, and also from the historical data that has been picked up on their medical records, their electronic medical record, is making sure that best practice is being provided. So there's also the element of patient satisfaction. With more patient satisfaction, there's more patients. More patients means more profits for the health system, and more profits means better care. So it's a cycle of improvement. Apps are just one way. We have virtual health, we have got robotics, we have data systems that are able to better compute the accounting and the finance issues. We have got all this information that is fed back to management, who can now make better decisions overall for their geographic area, for the strategic plans for the hospital. So in essence, what IT is doing is it's improving the circulation of information throughout, and it's not limiting itself to physical. It's now going virtual. It's cutting back on paper and things like that. And so less storage is needed, fewer buildings are needed. So that is what IT can do. I hope that helps in that question.
It does, Gladwell. I think now I'll hand over to Tony. Tony, you can take over now.
Yes, I can. Thank you very much, Gracie. And everybody, good evening and good morning, if depending on where you are. Very, very sound engagements going there. Thank you so much, Gladwell, for those very insightful words. I want to go to Naomi, and the first question I will ask is, medical devices and wearable technologies are becoming more sophisticated, enabling continuous monitoring of patient health metrics. How can these devices be integrated into clinical practice to provide more personalized and proactive care?
All right, thank you once again for that question. The wearable devices are making a huge, like they're really coming in at a rapid pace into healthcare. And like, for example, we have off on top of my head, the ones that I know that are really common, like the cardiac monitoring, the ones that patients are sent home. And the benefits of these wearable devices is providers and cardiologists are actually able to capture data in real time. They're able to monitor the patient. They're able to collect all these numbers that they need to collect while the patient continues on with their life, the daily activities. And that's we find that's the best practice to be able to capture the accurate data. Because in a hospital setting, when somebody comes into a hospital and we're trying to do all this monitoring and capture the patient's numbers and, just trying to figure out what's going on with the patient, right? We really don't get a good feel of what the patient does at home. So with having all these wearable devices, it's helping us capture the data real time. It's helping us monitor the patient real time, because we tell the patient, you actually have to continue with your daily activities of your life. So we're able to have a good feel of what's going on so we can identify what the problems are. So they're really helping with capturing real-time data. And then the other benefit is, and this one is common, and I'm not promoting anything. One of the fights we've seen with Apple Watches is patients coming in and saying, oh, my watch told me I have AFib. Oh, my watch told me that I have my heart rate is actually low. So, and you can see that Apple is really doing a good job at enhancing the health part of their watch. And you'll see even providers, they're promoting a wearable watch if they know that this person may benefit from it. You know what I mean?
Mm-hmm.
So it's the wearable devices are coming more and more. We also see the other wearable devices that are used is on the elderly population, which helps monitor their, their risk for falling, their how their ambulation and mobility is. So these devices, you can't lie when you're wearing a device and you're responsible for wearing a device, right?
Mm-hmm.
The other devices that I know for sure that have come a long way is these ones I see them mostly in the pediatric generation for type 1 diabetes monitoring is the glucose monitoring. They've now, they're infiltrating in the adult population, but for years, the pediatric population, just because of the risk of the diabetes monitoring, the glucose levels and insulin injection, they've come a long way and they're helping keep patients safe. We are not having the death for pediatric patients who have type 1 diabetes has significantly dropped because it does alert the patient. It does alert the family member. It does alert the provider that, hey, this patient's blood sugar is dropping. Somebody needs to attend to the patient. So they're coming a long way. Yes. Do we have a little bit more way to go? Of course, we still have ways to go in improving the devices and just adding more wearable devices to even the healthy people so we can capture more data. So yeah, so the wearable devices are really helping the providers in capture the data real time.
Awesome. I don't know how technology is leveraging on that in terms of like, I'm just wondering if do people like Mark ask for information that is like on a wearable device and like run an analytics on that and how that is going to affect healthcare in the future. And so then the question that I would want to ask Mark, based on just what you've just said, healthcare analytics, being a rapidly evolving field with constant advancement in technology, data science methodologies, and healthcare delivery models. How do analytics professionals stay current with emerging trends like what she just said, and the best practices in healthcare analytics? And also maybe tell us what opportunities exist for professional development and continuing education, Mark.
Yeah, so thanks, Tony. I think it's not wrong to assume that probably some people attending this particular webinar could be aspiring analytic professionals, or they're already in this industry. So just to answer your question, we already talked about new technologies like artificial intelligence, mentioned about natural language processing. We talked about machine learning, which I'm sure is trending right now in tech. So looking at all these advancements, it just makes sense for an analytics professional to really keep themselves updated. And one of the ways they would do that is to attend webinars such as the one we are holding right now. These are good avenues for you to understand latest advancements that my colleague panelists, the likes of Naomi and Gladwell, are talking about. They would attend workshops, physical workshops, conferences. Those are good avenues of obtaining such kind of updates in your field. Secondly, it would also make sense to continue getting certifications and courses in that industry. You can probably think of pursuing certifications or also enrolling in online courses in areas like healthcare informatics, machine learning that I talked about. You might think of healthcare data management as a course. I think all these courses are available online, and some of them actually for free, even on LinkedIn. So that is also one way of keeping yourself informed in this industry. The most important one, in my opinion, usually is networking industry professionals. Yeah, because you might think you know it all until you continually interact with some of these professionals. Then you exchange ideas. Then you're able to pick out certain gaps that you have in your knowledge base. And essentially, that's how you keep yourself updated. An example, for example, participating in healthcare analytics conferences helps professionals to learn about innovative approaches so they can leverage on the new technologies like AI and the rest. So that's my view about what analytics professionals need to do just to keep them updated with what's happening in the industry.
Awesome. So in the next coming years, of course, we're expecting to see a lot more of that make sense, because people are now starting to understand the relationship between data and decision making. And all that is achieved through integration. And therefore, the next question I'm going to ask, and I'll be asking Gladwell, how has integration of tech transformed healthcare delivery? And what are some notable examples of its impact on patient outcomes?
Yes, IT has come a long way, not only in the service delivery. For example, now, you know, if you walk into any hospital room, you're seeing all kinds of gadgets lined up there right next to the patient, which speaks to better monitoring, better alerts, better care for the patient. That equipment is actually relaying data to the people behind the scenes who are collecting that information, analyzing it, and are able to make better decisions on a management level, on an operational level, safety level. When we're looking at surgeries now, we have some surgeries are even being done by robots. There are some surgeries that are being done virtually, meaning the doctor the surgeon on the ground is taking instruction from a specialist in another country. We're also looking at much more efficiency in the general finance and billing. We're talking about more gadgets. We're talking about doctors being able to notate their interactions with patients with a lot of audio equipment, so they don't have to sit down and write out notes or have somebody dictate to them. This is allowing the doctor to be more mobile within the clinics. They don't have to sit down in any one place. Information is being secured now in encrypted devices, not necessary for us to have the kind of storage rooms that we used to have. This is better for the patient because they know that now that information is not only secure, but it's portable. So if I am in Nairobi and that's where my doctor is, but I take a trip and I go to, let's say, Kisumu, I have everything on my phone, or I have everything in a USB that I can transport. That is something that my doctor in the new place can pick up and run with. So the outcomes are so much better. As you can see, there's 1,000 ways that IT can actually improve healthcare and its outcomes. The sky is the limit. Imagination is the only limitation. Data analytics is one way that we can go into it, and it's a great way. I really thank 7net for even putting this together, because it shows how data is valuable. We're also talking about electronic health records. We need more avenues to make this electronic health record be portable and movable. We also need people who are going to teach these skills, like 7net is doing, is relaying this information in healthcare or in any other field. We need people who can relay this information, not only to the professionals who are coming into the field to make them better professionals, but we are also talking to the staff who are already there. We're telling them, this is your regular workflow. This is how tech can make your workflow better. So there are many ways to get into IT in healthcare. All of them are pointing towards better outcomes for the patients. And yeah, so that would be what I'd like to say on that.
Listening to you, I'm thinking about the new health insurance system that is being introduced in Kenya. And, patient record, especially as you talked about, that you're able to move from one dispensary or hospital, and you don't have to, at the touch of a button, one is able to, get all your records. Is that something that you think should be pushed? I mean, there's been a lot of blowback in terms of no, why didn't you fix the old system instead of starting all over? Is this something that maybe you think people like you and those that are in the profession should actually be given more opportunities like this to speak to the public out there so they can understand the benefits that this brings?
Absolutely. I think let's be honest. The days of paper are fast leaving us. And so there's going to be a time where if you're working with a paper record, you are almost redundant. Eventually, we are going to have to move on to electronic health records. What a lot of the health systems that have been doing, they've been individualized according to the health system. Like now, what Nairobi Hospital uses might be different from what Aga Khan uses and things. The push now that is coming, and it's also affecting insurance companies and things like that, is they're saying, why can't you all talk to each other?
Right.
The government system, the health system are saying, why can't Embu speak to Meru? All these hospitals everywhere, why does somebody have to, why is there a break in communication? So it is a very big shift for us to move into that electronic healthcare space, but it's inevitable. And definitely people's concerns need to be given an opportunity to be aired and addressed so that the troubleshooting can begin before implementation.
Right.
People need to understand, what are these electronic health records? Where is my piece of paper? Where is my actual, so people, it's very nerve-wracking to think that anybody is collecting so much data. Like if someone is asking you for questions on your health records, you're like, why do I have to share all that with you? My doctor knows that. But the benefits eventually will outweigh the way things are now, in my opinion, only because we must move away from paper. Paper degrades, and it's not really very efficient for communication. So yes, I would say yes. Let's open up more channels for yes.
Awesome. Thank you. I'm just imagining those things, that the half exercise book that we used to carry, and things are written there that only doctors would understand, and clinicians. The COVID pandemic, I'm talking to you, Naomi. that has underscored the importance of data-driven decision-making in public health response efforts. How have analytics been used to track and mitigate the spread of, viruses, forecast healthcare resource needs, and inform vaccination strategies?
Once again, I want to thank COVID vaccine because it really expedited a lot of things that were taking so long to be implemented. And one of it was data analysis. What COVID did, it forced everybody to learn, everybody in leadership and everybody in technology and everybody in data. We were all forced to be able to learn how to look at data and help make decisions faster. One of the benefits was it brought a lot of transparency in data because we were able to know, okay, because in our organization, we have a stream of like 16 hospitals in one area. So we were able to know that, okay, that particular area, they have more of the virus than we do in this other area. So guess what? That area got more resources faster. They got the vaccines faster, right? So that helped spread out the resources, and it helped narrow down and know what is causing that area to be hit more with the virus or the COVID and all that. So it did force people to learn how to look at data and analyze data more faster. It helped, and the data that was collected helped make the decisions on where were the resources going to be taken to first. It also helped look at the population and the diseases that it helped analyze people's diseases. Were the people who are getting these diseases have comorbidities or they don't? And one of the big things we learned with COVID, if you had two comorbidities, your chances of survival were less versus a healthy person, because healthy people, we did not need to keep them in the hospitals. We told them, go isolate yourself at home because we knew they were going to survive. But if you had a comorbidity, no, you were housed in the hospital because your chances were much more less of survival if we didn't keep a close eye. So the data analysis helped us narrow down resources and deciding who's getting more PPE, who are we going to give the vaccinations faster.
I feel like we could go on and on with this because there's so much learning, that came out of this. And at the back, we do not think of this as data, as information that can actually help us make decisions. But when you speak about it now, and people are able to start seeing why this decision was reached, and so moving into the future, definitely what you said is this learning from the COVID-19 is going to inform how future decisions are made based on the data that is available. And I think this is what draws into what Gladwell just spoke about earlier. So, Mark, looking ahead, what are some of the emerging career opportunities? And I mean, we are looking at data, and I think it looks like a product. So, what are the emerging career opportunities and challenge in healthcare system analytics, and how can individuals interested in this field position themselves for success in the evolving healthcare landscape?
Well, thanks, Tony. And again, I'll just assume that there are already people in our audience today that are purely here to figure out how they can take advantage of some of these career opportunities. And I think largely all the three of us have talked about the emerging trends and technologies in tech that can be used to support healthcare. And if definitely you are you have your ears on the ground, you have probably heard of artificial intelligence. That is really big right now in tech. So if you're thinking of taking advantage of certain career opportunities, it just makes more sense to take advantage of opportunities like harnessing the power of predictive analytics and clinical decision support systems using AI and machine learning technologies these are technologies that you are able to grasp through different career paths in tech. It just doesn't have to be data analytics or data science or business analytics that I talked about, or information informatics specialists. It's a wide variety of IT. So nowadays, whatever tech career path that you pursue, there are high chances that you will find some aspects of AI, you will find some aspects of machine learning. But specifically in healthcare, I would say the AI-driven applications, such as predictive modeling, which is very big in data analytics, can be used for disease diagnosis. It can be used in personalized treatment plans. And the chat box that I also talked about earlier on are really important. And all that is done by software engineers who have understanding of those programming languages that I mentioned, Python, R, SQL. So if you have a grasp of those programming languages, then it's easier for you to penetrate and take advantage of some of these opportunities that healthcare industry has to provide. Definitely, despite the opportunities that exist and the benefits, there are challenges to these advancements. And one of them specifically in healthcare would be some of these machine learning algorithms and AI make assumptions based on historical data. Yeah. Mm-hmm. So some of those assumptions might and this is not to scare you, just to be objective. Some of those assumptions can be detrimental to patient health. And that's why, as analytics professionals, we need to try to be as accurate as possible in coming up with these models, because it essentially involves, especially in healthcare where life is actually involved, we need to be very precise. Just to conclude, some of those models, for example, I just want to give you a very real example so that you see how safety can be an issue. That algorithm, for example, can breach certain data security about a particular patient. They might assume, for example, that a certain gender based on historical data is prone to certain kinds of diseases. So when you apply that kind of tech to that patient, it's more likely to predict a certain outcome without critically looking at that specific client. So it ends up misdiagnosing. It's not common, but again, we can't fail to point that there are possibilities of those kind of loops. So those are the opportunities that I foresee in this field that aspiring professionals may want to take advantage. Thank you.
That's amazing. That's amazing, Mark. And I'm intrigued when you talk about the challenges because it's so real. Reality is that we're going into AI, and the outcome of what an AI decision, or outcome will be based on the information that it has received, the way you've taught it, and that is what now depends on the amount of data that is going in, which is something that probably at this time we can say is what has pushed China ahead, because they have more people and therefore more data and therefore better scope, of understanding. And so when I listen to you, talk about this challenge, and it's very, very practical, do you see a situation where we need to encourage more people to understand the need then to get into this space so that everyone understands the value and therefore provide as much accurate information or as much information so that better decisions are made?
Yeah, absolutely, Tony. And that's where I really appreciate platforms like these ones organized by Bennett and CUSAT. It's through this kind of avenues that really people can get to understand how big this industry is growing. Because 10, 20 years from now, we'll be looking back and looking at, because right now this is like a movement, a technology movement that is happening. And especially from developing countries, we tend to take note of most of these movements when we actually past them. Yeah. So through these avenues, I think people really need to understand what's happening in tech, this big data, analytics, and AI, so that we are able to become part and parcel of the future that is likely to emerge as a result of this.
Right. Before I let you go, for those of us who had the opportunity to get into the tech field, we initially people feared computers. Even now, there are a lot of people who, it's tech. That's the field for people that are in mathematics and all of that. And a lot of people probably will not be happy having to do any mathematics. And this is what data analytics is all about. And I know we don't have a lot of time, but I really want to engage you on this. In understanding the value then that data analytics is likely to provide in terms of making sober decisions, especially in a critical field like healthcare, are there wider windows now open for more people to actually get into this career without necessarily having to look back at, I was an A student in math, and therefore I'm the one that is qualified. I was a D student in math, and therefore maybe this is not my field. What would you say about that, maybe to someone that is out there that is listening?
Yeah, well, and I feel like you're directly speaking about my own experience, Tony.
Okay.
Personally, even though I took my bachelor's in electrical engineering, but I was not so passionate in tech, I would probably have been a very poor engineer and dangerous for the society. So I chose to practice it. Yeah, that was way back in 2014. So I moved right into business development, sales, and marketing because that's where my passion has always been. So I've basically been in an untechnical profession for the past slightly over 8 years now. It's when I made the decision to come back to analytics when I took up my master's in business analytics. And at that point, I didn't know coding. I didn't know a lot of technical stuff, these programming languages that are required in this field. But because it's something that I have made the decision to pursue, I've been able to understand most of those languages, and I can apply them in industry. So just to answer your question in very few words, it's very possible for anyone who doesn't have a technical background to get into this field. We just need to take advantage of some of these courses that are offered by organizations like 7-8 and the rest. They will give you insights and foundational information that will help you to become a better professional. Parting shot, I know in the interest of time, when I was taking my master's in business analytics, for example, we had a lot of my colleague students that came from business backgrounds, healthcare, medical backgrounds, but they were able to eventually end up as professionals in analytics. So it's light at the end of the tunnel, I think, for everyone in whatever industry.
Awesome. Thank you so much, Mark. Gladwell, looking ahead, what emerging technologies do you believe will have the most impact on the future of healthcare delivery? You've been very, very elaborate, and I like the way you're putting this out, but how can stakeholders prepare for these advancements?
Yes. How can we prepare? Let's embrace technology. let's begin to adjust to the idea that we're moving into a new era. Let's take advantage of a lot of the learnings that are out there. Like Mark mentioned, a lot of these learnings are available freely. We have 7-8 here. We can also tap into some of the technologies that are already available. What I see coming forward now, and I think is going to actually be very helpful, is remote monitoring of healthcare. Telemedicine is coming. So remote monitoring has already been explained by Naomi. Telemedicine, we're all now familiar with doing our sessions online and things like that. Robotics, those are, they're coming up. These gadgets and apps, finding the right ones for us, dabbling with this one and that one will help us figure out which one is the best one for me. Becoming very well informed with health issues. Online, you can Google anything. For example, like my background is in mental health. I'm not an IT professional per se. I'm not a coder. My background is primarily in mental health, but how I've ended up in healthcare IT is in teaching the new applications, coaching in the new applications that are out there in healthcare, in electronic health records. There are things like the DSM-4 or DSM-5, whichever version, that are now in app form. So you don't really need to necessarily go to see a psychiatrist to be able to have an idea, maybe not necessarily diagnose yourself, but you can educate yourself on different mental health conditions by just going to the app and plugging in your symptoms and then getting an idea on recommendations of where to go next from there. So I see more of that coming along. I see a lot more marriage between healthcare and IT in the form of clinical informatics or healthcare informatics, like Mark mentioned. I think people can jump into the healthcare field by taking advantage of those training opportunities now, so that you're growing with the field.
Right.
Those certifications now, so that you are keeping yourself abreast of what the developments are as they're coming, because they're rapidly approaching us.
Awesome. Thank you so much, Gladwell, for that. And I believe all this information that has been shared, it's just too much. I feel like maybe this session should be repeated so that we can go into breaking down some of these terminologies for someone that is not tech, so that we kind of demystify this whole space and therefore invite and welcome more people to find a place and a footing in it. Thank you so much. I want to hand this over back to Grace. And as you do that, Grace, I see there was a concern by Wandera, who is saying that, is there a way we can do away with the physical medical claim forms and have decentralized medical insurance claim forms? I'm sure that has been addressed by Gladwell. Maybe if you have something to add, Gladwell, and then Grace, please take over.
Thank you for that question. Yes, there is a way to do away with physical medical claim forms. A lot of the data can be collected during the treatment, and that data can be captured and coded and submitted as electronic medical claim forms. And if there is a communication between the health system and the insurance companies, then they would be able to receive that in real time, and the billing process would happen and they would be able to do their payouts. So that's how I envision that can happen.
Awesome. Thank you so much. Back to you, Grace.
Yeah, Grace, I think she's having a problem with her internet. So
okay.
At this point, we are going to Q&A. We are really out of time. Harriet, can you hear me?
Sure, I can hear you, Geoffrey.
Yeah, okay, go ahead and we'll take the shortest time possible. Maybe we answer some few questions.
Oh, thank you. I think we just have one question because the other one has been addressed. The question we have is from Irene Gaita. She's asking, what's the best ways we can use tech AI in marketing healthcare business? I think I can pass this question to Mark. Mark, I heard you talk so well about career opportunities, and then you also mentioned about liking sales and marketing. So are you in a position to address that question? Thank you.
Yeah, of course. So basically, integrating tech and AI into marketing can really significantly help businesses to enhance efficiency. So in the interest of time, I would probably just highlight some of the areas that tech can be utilized in marketing healthcare businesses. One of them would, for example, be the use of predictive analytics for patient management, where here you can employ predictive analytics to forecast patient needs and behaviors. There is also content marketing that is traditional, it's been there. So you can develop informative and educational content about healthcare that is relevant to your audience. Then you can use AI tools to optimize content for search engines that is SEO, just to tailor it to meet the needs of different patient demographics. And there is the aspect of telemedicine and remote monitoring that I think Gladwell or Naomi spoke about. So you can leverage on some of these platforms to enhance remote monitoring through some of those devices. Yeah, then personalized communication also, because the use of chatbots that I spoke about are also a good way of providing personalized responses, just to help with scheduling of appointments. So that improves customer service and engagement. And when you do that, then obviously you're able to get more business and eventually become more profitable with such avenues. I think those are my thoughts, Grace.
Well, thank you, Mark. We appreciate that. I think we've asked there that you share your contacts for further information. Savenet has already shared their contacts there. Thank you. Over to you, Mark. Not Mark, Mak'Ouma, sorry.
Yeah, Mak'Ouma. Mark took my name. I don't know why he did that, but anyway. So I want to say thank you so much. It's been over 1 hour. We tended to finish within an hour. But again, it was so interesting. Everything that you guys were saying, Mark, Gladwell, Naomi, they were just wonderful things. The things I could relate with. I mean, one thing we have to agree, whether you like it or not, tech is coming, and we have to embrace it. It's going to change how we talk, how we sleep, how we do things, how we eat, how we act, how we wake up, how we walk, how we do things, literally everything. So the best you can do is to get yourself walking that journey with everyone. Tech is changing how healthcare is going to be perceived, how people are going to work in healthcare. You've talked about wonderful things that I don't have to mention. One thing I want to ask Naomi, Gladwell, and Mark, and of course, Tony, to share your information if anyone needs to contact you for the things that you're doing. I know Gladwell is doing consultants, Mark is doing a wonderful thing. For just 1 second, please, if you want, you can share with them how they can contact you. I know there are people here who are looking to get into connecting with you after this. Mark, starting with you.
Yeah, so basically I'm in Kentucky in the US. My contact is, maybe my email is mark.omondi@Louisville, LOUSVILLE.edu. Maybe I can just leave it.
Yeah, I think the best would be write them in the chat. You can
Yeah.
share that in the chat. Okay.
Thank
you. Gladwell.
Thank you for that. I'm going to paste it in the chat. My consultancy is Psych Solutions Global, and that's my email address. You can reach me there.
Okay. Naomi?
Hello, yes, mine is mer for me at gmail.com, and I posted it in the chat as well.
Thank you. Tony? You're on mute.
Okay, yeah, Tony Shira. I am based in Seattle, Washington. I am in media and, of course, very, very interested in tech. So I'm a mouthpiece for anybody that has any information that is related to anything, you know, to take it out there. I'll put my contacts over there. I have a YouTube channel where I will also be able to rebroadcast what we've actually gone through. It's called TCTV1 USA. And I think that then will be helpful. I'll put the details up on the chat.
Yeah, and Grace works with the Nation Media. She also owns an organization. You can connect with her on LinkedIn. She's called Grace Kirongo. I believe I'm pronouncing it well. So she works with the Nation Media. Thank you, everyone. Thank you especially for people who have attended, who have been with us since we started to now. I would appreciate you. We are looking to have more webinars on tech, passionate about tech, talk about tech all the time, from kids to the older people, okay? So we'll be doing more webinars, we'll be doing them. So today was about healthcare. Tomorrow we're going to about maybe an aspect of tech, and we're going to have wonderful guests, panelists like the ones that we had today. Look forward to meeting you. You can always reach out to us. The phone number is given there. For those who want to get into KUSATA is a Kenya US Tech Forum. It's a forum that brings people who are passionate about tech right from Africa and here. So if you want to get into tech, you're already in tech, you want to network, you want to share ideas, please get in touch. I wish Harriet, maybe you can share with them the link to the WhatsApp group for the Kenya US Tech Forum. So please check the chat. You're going to see that for those who are interested to get to joining KUSAT, you're welcome. Those who want to get more information about 7-8 and our training, I've shared the phone number there and the email address. Please reach out to us. Share this information and let's see each other next time. Unless somebody has any question, anyone with a question that has to be asked or answered before we leave? None. Thank you. Be blessed. See you next time. Have a good evening. Good night.